Thank you. Thanks everyone for being here. Can everyone see my screen okay? I assume so. So you'll notice the title changed a bit as well. Given the time, we decided just to focus on the clinical text portion of the talk. So my name is Corey Arnold. I'm an assistant professor here at UCLA in the departments of radiology and pathology. And I lead a new program that we call Computational Integrated Diagnostics that attempts to take clinical data from both departments and combine them in new ways using machine learning. So for this talk, I'm primarily going to talk about how we've applied topic modeling to clinical notes. And first, I'm going to just give a little background on what topic modeling is for those who may not know. So for a human or a computer, understanding the stream of language requires contextualization. And knowing this context of, let's say, a document facilitates your ability to disambiguate the terms you see in that document. And it also allows you to, sort of retrieve related concepts in your memory and have them there so that when you see them, you recognize them more easily. So one example would be if we have the word heart. If we know the gist of a document is about heart attack, then we would expect the words vessel and acute to also increase in that document, versus if the document is about heart defects, we might then expect the words congenital and valve to increase in that document. So topic models attempt to understand this context, and they do that by modeling topics as multinomial distributions over words. So I have two topics here on the right side of the screen, and you can see I've given them names, science and nature. And so within a topic, each word has some probability, and what makes topics different are the way they allocate this probability over the words. So you can see the words in the finance topic are about finance, money, bank, federal, and nature. They're about nature, stream, river, deep. And one thing to notice here is that the word bank can be highly ranked in both topics. So the model has learned that the word bank has multiple senses, and it can discern them from the collection. So that's how we model topics. How we model documents is we're going to say documents are actually mixtures of topics. And so a document, it's a generative model, which we'll see. A document is defined as a multinomial distribution over our topics. Okay. So what are these things useful for? Well, I'll go into some of the applications in subsequent slides, but we can use them for prediction, disambiguation, and that should say gist extraction. So we can use them for automatic summarization. So the next question is, how do we model gist? And before I go on, just briefly, on the lower right, I have a very generic diagram of what topic models attempt to do. So they're generative models, and on the left here, we see there's some latent structure in the background that's generating words. If we zoom in a little more, we might say we have this top node G, which is our gist, or it's our sort of model of all the topics in the world. And from G, you can sample one of those topics. And from that topic, you can sample words according to its multinomial distribution. Okay. So how do we model gist? Well, there's a distribution out there that's very convenient for what we want to do called the Dirichlet distribution. I'm not going to go into too many details about it, but what you understand is that when you sample the Dirichlet distribution, you get back a multinomial distribution. So that sounds a lot like what I described on the last slide. And that's why this particular distribution is such a good fit for what we want to do. In addition, it has this property that it's conjugate to the multinomial, which simplifies parameterization of the model. So what you get is, when you sample from a Dirichlet parameterized by some vector of alpha, you get back this multinomial distribution, right? Where all the probabilities are greater than or equal to 0 and they sum to 1, okay? And what's nice is that if you have these probabilities and you're given data, you can say that the parameterization of that Dirichlet is simply the alpha values updated by the count of observing that variable. So think of them as words. And so what you'll get is a sample that reflects the pattern of words you've seen in your collection. So that's a nice property. And so I've also just listed out the probability density function here. And here's just a graphical representation of a three-dimensional Dirichlet distribution. And you can see how it sort of allocates probability. If you think of the corners as being topics, these are multiple samples from one distribution. And so the higher the peak toward one of the corners, the more likely you'll see that topic. To make that, oh, I think it's, yeah, okay. So sort of the seminal model in this area was latent Dirichlet allocation, which was published in 2003 by David Bly, Andrew Eng, and Michael Jordan. And I'm briefly going to step through the generative process here. So the first step we do is we generate a theta based on our Dirichlet alpha. So we sample the Dirichlet and we get this theta distribution here, and we do that once per document. Okay, so plate representation of LDA, where the plates denote replication, and shaded nodes are observed variables, and everything else is a parameter. So we sample our Dirichlet once per document. We get a distribution over topics. We sample that distribution. We select one particular topic Z. We then index into our topics here. So these are all of our multinomial distributions over words that we've learned called topics. And we sample a word. Okay, and so we do this n times, so the number of words in the document for D documents. And that's kind of the generative story of LDA. And so what LDA does when you're fitting the model is it attempts to learn a topic embedding in your word space. So let's say I have 3 words and a collection that's composed of just these 3 words, and I want to say there's 3 topics within that collection. And so what LDA will attempt to do is it'll learn the topics as through the probabilities of the words within the documents. And so you see here in this simplex, we have the word simplex, and we have a topic simplex, and you can see that. So topic 1, it's close to this edge of the triangle in the word simplex, so it favors word 1, and word 2 a bit, but it's very far from word 3. So word 3 has a low probability in topic 1, okay? Topic 2 favors word 2, topic 3 favors word 3, and so this is just geometric interpretation that's meant to sort of give you a more intuitive understanding of what's going on. So if you were to sample this Dirichlet distribution in the middle, you would get 1/3, 1/3, 1/3 for each topic, versus if you sample on the edge, you'll get a distribution over topics that's 1, 0, 0. So this document here would be all about topic 1, versus this one would be about all 3 topics, okay? So now, how do we learn model parameters? How do we learn our alpha, theta, Z? Well, there's a couple different ways to do it. One is called variational inference, and it's quite complicated. A more simple way is called Gibbs sampling, so an MC-MC method, and that's easier to understand, so I'm just going to review that briefly. With Gibbs sampling, what we do is we randomly initialize each word in our collection to one of our topics. We then hold out a word and resample it given the rest of our data, and we iterate over our words thousands of times. So how do we do that reassignment? Well, we have the probability that word I belongs to topic J here. So this is sort of the topic index for word I. So what's the probability that equals J, given the rest of our topic assignments and the rest of the words in the collection? So that's actually a fairly simple thing to estimate. It's simply the probability that we see word I within topic J times the probability of topic J in our current document D. And so these are just frequency counts of words in documents. Okay. So to show an example of this, if we have 16 documents, and let's just say they contain these 5 words, and we randomly assign each word in each document to one of 2 topics, the white topic or the black topic, and then we were to run our Gibbs sampling routine on this, after 64 iterations, we find that these are the ways the words distribute within the documents, and thus this is how we fit our topics. Okay, so we see that the first topic, the white topic, is about nature, the black topic is about finance, and that the word bank can be shared across the 2 topics. Okay, so this is the basic process that's used for many, many topic models out there, just variations of this sampling routine given different variables. So some limitations of topic models. One is that words are exchangeable. It's essentially a bag of words model. There are some things we can do to mitigate this limitation, including pre-processing. So there's a lot of nice concept mapping software out there, especially in the medical space, things like MetaMap or CTAKes. So we could run those algorithms over our collection first to try to normalize multiple word concepts. We can look at n-grams, so I'll have an example of that later, where we can tell the model to try to learn sequences of words. The other limitation is that documents are exchangeable, or this is a bag of documents model. And that's very much okay for many things, like websites on a particular subject. You wouldn't expect there to be a difference in the ordering of those websites, but it's a bad assumption for medicine, where if you're looking at a patient record, you would expect to see somebody, get diagnosed with a disease before receiving a treatment for that disease. So now let's jump into a clinical example. So what are some of the topics that we would find in patient records? So we took 500 glioblastoma multiforme patients, all of their clinical notes, and we separated them into their respective reporting areas shown in this table on the right. So we have, imaging topics from MRIs, CTs, and PETs, other radiology reports. They might have x-rays or things. They have oncology progress notes. They have op reports from neurosurgery, discharge summaries, and they'll have pathology reports. And so what we did then was we built a topic model on each of these areas. One thing I've kind of glossed over thus far is how do we know how many topics are in a collection? Well, we don't really, right? It's a parameter that we have to supply. There are non-parametric versions of topic models, but essentially, you just sort of guide the topic through, guide the number of topics through a hyperparameter, so it's not much different. So one way we can do it, though, is we can compute the log likelihood of a held out set of documents given a topic model. And so that's what we did here, where you can see we fit models to each of these collections with different numbers of topics, and we selected the topic model that maximized the held out log likelihood of a document set. So, different collections support different numbers of topics, but in general, they're all less than 100 and closer to 40 or 50. And that's kind of a function of the size of the collection and the number of unique words in it. So some of the example topics that we found are shown in this table. We have things like topics describing the resection cavity. So brain cancer patients frequently get resections, and the status of the resection cavity is very important in follow-up imaging. We have words describing the resection procedure. We have words in discharge summaries describing quality of life assessments. We have words that are topics that come from the actual biopsy, and then we see topics that correspond to oncology notes. And what you can do then is given a topic, and so a topic like care plan might not be an intuitive thing to index with, methods like Lucene or something like that. The keywords for it might not be very easy to define, but with a topic model, you can sort of sort your documents and rank them by those that discuss a care plan. And so we see an actual note here. And again, remember each word is assigned to a topic, so you can highlight the words in this note that came from the topic care plan. So what do topics mean? Well, log likelihood gives us an objective metric for a model's goodness of fit. But one of the big limitations is that if we want to use topics directly, we kind of need to agree on what they mean. And it's true that some topics are more salient than others. So one question is, well, how do we measure this? So there are a couple metrics out there that people have used in the past. One is called word intrusion, and that measures the agreement with words in topics across people. And then another is called topic intrusion, and that measures the agreement of topics within documents across people. And we're going to skip that for today, but we have a publication on it if you'd like to learn more. So talking about topic intrusion, we fit a topic model to about 20,000 documents that contain progress notes, consultation notes, history and physicals, discharge summaries, and op notes from 924 patients. These were patients with brain cancer, lung cancer, or ischemic stroke. And we then had people review the discovered topics. And so we had 7 primary care physicians and 11 informatics grad students. So we compared them. And we had 3 LDA models, one with 50 topics, one with 100. and one with 150. So for the word intrusion task, you show the top 5 words from a topic, right? Because again, a topic is defined as a multinomial distribution over words, so you can rank the words by their probabilities. And then we show the user the top 5 words, and we then add some random intruder word. And so the task is really, tell me what word does not belong here, okay? Sort of a game we all probably played as children. The key, though, is that the word has to be a low probability in the current topic, but it has to be a high probability in a different topic. Otherwise, there are words that are low probabilities across all topics, and you're not interested in those. So then we measure topic precision as the fraction of users who agree with the model. And so here's just the equation for that. It's essentially, you get a point if you agreed with the model, and divide by the number of subjects to get an average. So higher numbers are better. Here are some examples that we showed. So see if you can pick the intruder word from this list of words. Should be pretty obvious in this one that sodium does not belong. This topic might not be quite as clear, but I believe it's PID. Yes, because that's more of a discharge note. And in this topic, it's maybe if you're a clinician, you might know. I didn't, but the word clear does not belong here. Okay, so that's essentially what all of our subjects went through. So our results, we found that primary care physicians were significantly better than students at identifying the intruder word, and that's a good thing. That means that our topics are, discovering something that represents the actual clinical expertise within the documents. We found that the PCPs were also faster, although that might just have been that they dedicated less time to it than our graduate students. It also wasn't significant. Yeah, so that was a good finding for us. And we found that 100 topics were significantly more interpretable than 50 or 150 at a p-value of 0.09. And for students, 100 versus 150 only. So what were some of the topics that they looked at? So these were easy topics. So everybody got these right. The topic precision was 1. They are pretty obvious to me even. Then we have hard topics where nobody got them right. And again, that sort of makes sense if I look at it. And then we have contrasting topics where the clinicians got all of them right, and the informaticians or the graduate students got them all wrong. And so this is an example where we think the model might, is capturing things that physicians understand due to their experience writing and reading clinical notes. If we compare these findings to other work in the literature, so how interpretable are our clinical models versus those that have been fit to more general collections, we see that, well, they're not quite as interpretable, right? It's good that PCPs do better than students, but in general, we find that a news collection or a collection of articles from Wikipedia, topics discovered from those collections are more interpretable than ours, okay? And that's kind of a function of, we have a very specialized domain in which we're modeling versus, news or Wikipedia, you can imagine, is extremely broad. And so the topics are likely much less granular. They're more coarse, and it's much easier to find intruder words in coarse topics, okay? So it's nice having the humans do it, but that's kind of a constrained resource. And we were interested in how well automatic methods might do at identifying coherent topics. So we calculated something called point-wise mutual information for each topic. And what that is, it's a function of pairs of words. And so you divide the probability of 2 words occurring, I think we did in the same sentence here, by the probability of them occurring independently in sentences, and take the log of that. And so that's your point-wise mutual information metric for pairs of words. So we calculated this over the top 10 words for each topic. So we have 10 choose 2, so 40 combinations, and we then averaged the PMI for each topic and ranked them. So what we find then, if we compare humans to our PMI metric, is that there is some correlation. First of all, if we look at the number of topics and compare PMI to PCPs and students, especially with the 100 topic model, we find a positive correlation between the two. And if you look at actual topics, you can see, so topic 1, everybody kind of thought in the 100 model that it was a coherent topic. Topic 2, or the second topic here, there was some moderate agreement maybe, and then this third topic, you know, there's kind of no agreement. Okay. So this was, you know, not a home run, but it let us know that these automatic methods do have some benefit. So going beyond kind of basic vanilla LDA, you can really tailor these topic models to anything you want to do, as long as you can come up with the parameter fitting algorithms. So in clinical reporting, you know, a basic LDA model is interesting, but there's so much more information we can take advantage of, including patient metadata. So like the gender of the patient, how does that influence the topics you might see, or the disease history of a patient. At the document level, there's meta information. So who wrote the document? What service was that clinician from? You would expect all those things to influence topics. And then again, in medicine, words are really, or concepts are really expressed with multiple words, right? Probably more so than general collections due to the specialized nature of medicine. And so we developed what we call the clinical topic model. I'm not sure exactly what we called it in the paper, but this is what it was. Where you can see here, we have an extra plate for patients. Patients then have document collections, and we have some new stuff going on here. So we have meta information at the patient level, meta information at the document level, and we have some machinery so that we can learn the relationship between topics and this meta information. We then have the possibility for linking words. So we have a little indicator variable between pairs of words that lets us know whether or not words should be linked. So do we have multi-word concepts? And then we sort of have our distribution over topics and our extra machinery there to learn if words are linked or not. So we fit this model, I'm not going to go into all the details, to our GBM lung cancer and stroke data set using a stochastic expectation maximization procedure with Gibbs sampling and LBFGS. Here are some of this model. You can see here, topics have weights. And so if you think back to one of the initial slides where I showed that a model is parameterized with this vector of alphas, this is the alpha for this particular topic, right? So it's important that alphas don't need to sum to 1, right? They're just sort of a relative ranking of the importance of a topic in the model. So with this particular model, we can say, given we have a consult from a neuro-oncologist for a 30-year-old man, these are the topics that we would expect to see. So in our particular model, we can re-weight the topics given our meta information, right? So Temidar, okay, so this is a treatment. This is a imaging topic, right? So they're getting follow-up, surgical topic, versus progress. We have a progress report from a cardiologist for a 70-year-old man. We talk more about blood pressure, stroke, these sorts of things. And we see a similar, meaningful relationship if we talk about a progress report from a thoracic surgeon. So this is someone with lung cancer, and we see relevant topics there. So we fit this model by training it with 60% of our data and then computing the held out log likelihood on 40%. And we found that in terms of log likelihood, not surprisingly, it outperforms simpler models like topical engrams, latent Dirichlet allocation, and Dirichlet multinomial regression. So if we want, it's very difficult to use topics directly. So what people tend to do is use topics as features, sort of nice contextual features. So if we use that as features here for an application that will, maybe we could extend a cohort finding, these are some of the results we got. So if we took the average topic distribution over patients and then performed PCA on that matrix and looked at the first 2 dimensions and plotted patients, we found that we could actually break down patients. So, the first dimension kind of resolves disease and the second kind of resolves anatomy. So we find that they do seem to separate the disease. There's overlap because some of these patients actually have multiple conditions. And then if we do prediction, so given a patient's average topic representation, can we predict what disease they have? Here's a confusion matrix for that. We do a fairly good job there. Again, we have some outlier, or we have some mistakes, and some of these are actually where the patient has multiple diseases, or they have another disease that's very similar to one, like they might have interstitial lung disease. So their record, even though they have brain cancer, they have interstitial lung disease, and so their record still contains a lot of words about the lung. We can then classify or predict meta information given a document, and I think I have those results on the next slide. So if we say want to predict the author, right? Maybe I know our EHR system, it's often difficult to discern who actually wrote a report given, we have attendings, fellows, and residents. So maybe we want to create an algorithm that can tell you which one of those actually wrote the report. Getting a gold standard for that might be difficult, but so with this model, we can predict authors given the text. We had an overall accuracy of 83.2%. Our precision and recall obviously ranged, and our errors primarily occurred for MDs with similar specialties, okay? So you might have a neurologist and a neuroradiologist, and they'll probably talk about a lot of similar things, and you'll make mistakes. So we had, these are the authors. Okay, so some of the additional findings we found with this model is that we were able to detect salient phrases. So in terms of anatomy, we found, the concept lower extremity and cranial nerve emerged. We could detect tests, so MRI scan and blood pressure were joined as an engram. Symptoms like acute distress, and diseases. So glioblastoma multiforme and coronary artery disease were all captured as engrams within the model. We were also able to perform some disambiguation. So instead of just finding the word scan as a unigram, we also found the concept or the token MRI scan and CT scan. So the model learned that there are two types of scans. And same with lobes of the brain, parietal lobe, frontal lobe, lower lobe, that's for the lung. So that was reassuring to us. So let's talk about another potential application of topic models, and this is a project that we are still working on. But for primary care physicians, they are responsible for a wide spectrum of a patient's medical history. So if you're a patient and you're going to see a new PCP, that PCP is responsible for kind of reviewing your entire medical history to ensure that they're treating you correctly. And now that we're moving to health information exchange, that means there's even more information, okay? So they have to look at problem lists, procedures, labs, medications, all of these things. And studies show that a large portion of patient-physician interaction time is actually eaten up by reviewing one's chart. So scanning through previous notes and trying to get the gist of this patient. So this can lead to frustration from patients, decreased communication, and in the worst case, you can actually have medical errors resulting from this process. So we are attempting to develop or apply our clinical model that I showed in the last slides to drive a visualization for chart review. And so what the prototype of this model looks like is this. We call it the Patient Adaptive Retrieval and Summarization Engine. So I'll just go through this briefly. The sort of main part is this temporal view of topics over time. So you can see how a particular topic evolves. The topics are listed on the left here. So you can see we have topics about breast cancer, partial mastectomy, pain, and a cough. So this is a breast cancer patient. So we've highlighted these three topics, and you can see how they've progressed in this temporal window, as well as this broader temporal window below. So you can actually see when the diagnosis of breast occurred versus when these other symptoms occurred. And you can see that sort of breast cancer becomes less talked about in the record. The symptom of cough goes away. And so it gives you sort of a snapshot view of diseases and symptoms in a patient record. And then we also have we plot the actual reports here for you to look at. So when you click a report, it opens in this tab here, and you can actually highlight the words that were generated by a particular topic of interest if you've selected it on the timeline. So we're in the process of evaluating this model, and what we're doing is we have a cohort of patients, and we have had clinicians develop a set of clinically relevant questions for those patients. And we then have sort of a crossover trial where we have another set of clinicians who will attempt to answer those questions for each patient using either our current electronic health record or this PARS system. And we are working on, we'll then calculate sort of how accurate they were and how long it took them and how satisfied they were. So you can imagine, though, our challenge in making this work well is something I mentioned earlier again, is that we're using topics directly here, and so we have to agree on what they mean. And so again, this is where we're using a combination of automated methods and manual review to label topics. So that sort of wraps up all I wanted to talk about. I'm going to go through just a few other uses of topic models that we've done, and I have papers on these and would be happy to talk more about them offline. But topic models can be a great tool for exploring patient forums. So we've done a lot of work with pharmaceutical companies who are interested in better understanding how their products are being received in the market. And so this is just one example for rheumatoid arthritis patients, and one topic we discovered in posts that correspond to it. So people have a lot of price concerns about the cost of drugs. And if you look in the notes, it's sort of, the topic makes sense. We've investigated whether or not we can predict health-related quality of life from people's social media streams. So using Twitter, can we predict someone's CDC HRQL4? So this is a standardized metric. And one of the features we used here was a topic model. And we got moderate, or I think our AUC for this was about 0.64. So it's a very challenging problem. Tweets are pretty noisy. Another application is, can we model time, the temporal dimension in clinical reports? So for this work, we developed another topic model that fit topics or constrained topics to a beta distribution over a normalized time period. And this is just a plot showing some of the topics we discovered. So each line represents the probability of observing this topic over time in this patient's record. And so it's important to note that you have an imaging diagnosis. So this is a brain cancer patient that comes first, followed by a surgical resection, followed by radiation treatment, followed by imaging surveillance. And so this, again, could be useful in comparing patients or doing some sort of prediction in patients. We can also do case-based retrieval. So this is another paper we have where we experimented with, can we actually use notes directly with a topic model to find similar patients, right? So often case-based retrieval systems sort of ignore notes and focus more on more structured clinical data points, like lab values or ejection fractions, things like that. And in this project, we sought to see if we could use topics to sort of compare similar patients. And finally, you can use topic models for automatic image labeling. We attempted a while back to use a model called correspondence latent Dirichlet allocation, which models the joint distribution between an image and sort of the words that describe that image. The model works pretty well in natural images, I'll say, so like the Corel data set, but it doesn't work so well in medical images where we have, if we use the radiology report as a description of the image, because there's just too much detail and the semantic gap between what the radiologist is saying and what you're actually seeing in the image is too big. So with that, you know, that's everything I wanted to talk about, but I'd be happy to take any questions at this point.
Corey, clearly you were very clear and everyone loved the presentation. So I guess that's why there's no questions yet.
Well, it's early here and later there, maybe.
Maybe I'll jump in with a question. This is Andrew Su here. So really nice presentation. Thanks for doing that. My question is this, right? So you're, if I understand it correctly, your methodology right now is focused very much on the free text of the clinical notes, although you did describe some of the segmentation by sort of the patient metadata. And I guess I'm interested in how far you can push in that direction, right? For example, could you use lab test results and things like that directly as part of your model, sort of in parallel with word frequencies and things like that, and even pushing it to the logical extreme, right? I mean, if we eventually have genetic data or gene expression data or things like that, how would you see those being incorporated in your ability to sort of refine models on a personal level?
Mm-hmm. So we actually did use lab results, but actually we used like previous pathology diagnoses. So if you were diagnosed, right, with, you had a biopsy and you were diagnosed with adenocarcinoma or non-small cell lung cancer, how would that diagnosis in the past influence topics in the future? So I think there is the opportunity to do that. I think there are limitations, though. One of the big limitations is this is a, it's an unsupervised model in the sense that, I mean, so including some of that meta information imposes supervision, but not so much really on the topics that you get, right? You're still sort of at the mercy of the contextual co-occurrences of words within your documents. And you can impose restrictions on them, but they might not always look like what you want them or expect them to look like. And again, you need to say how many topics there are in a collection, although it's, like I said, there are topics that, or models that try to smooth that a bit. So I think there's some opportunity to push that. I would guess that for genetic information, though, there are probably more appropriate models. At that point, your actual application or clinical question that you have in mind is maybe a little different. I think that's sort of what will guide model selection there. I don't know if that clears it up a bit, but yeah, I think you can push it, but there are limits. And also, the more, obviously, the more variables you have, the more data you need, especially in a model like this that, doesn't really have a knowledge base that can maybe make up for smaller data sets.
Sure, makes sense. I was just thinking that, this issue between the number of features and the number of observations is already something that's, apparently the methods deal quite well with, because, right, language is filled with all sorts of words, and some of which are relevant, some of which aren't. So anyway, but yeah, I spot on. Thanks for your answer. One other just thought as I'm, if the, you mentioned that labeling, so it's an unsupervised method. I think at the end you mentioned this challenge of actually being able to align those clusters with something that's more human or clinically interpretable. If it were of interest, right? I mean, my group has looked a lot at sort of crowdsourcing, and particularly crowdsourcing in the context of language processing, and so I could see that there might be a synergy there in where you use the crowd to essentially generate very large training sets.
Sorry, you kind of cut out at the end there.
Sorry, using the crowd to create sort of larger training sets, and we've done some work showing that if you have high enough redundancy, so you're dealing with untrained crowds, but if you have high enough redundancy across your crowds, they do pretty well, even on sort of dense biomedical or clinical text.
Oh, okay. So that's interesting, right? My response was going to be that would probably work well for general text, but clinical text might be more difficult. But I mean that could be interesting, right? Because yeah, one of the biggest challenges is what topics don't really mean anything, right? Because that you're always going to discover kind of these not really nonsense topics, but just topics that reflect the little ways we use language but don't have a lot of semantic meaning, versus the topics that do mean something, and then figuring out, well, how well do they really mean that something, and what exactly do they mean? So I think that's why you really haven't seen topics used directly in the literature very much in applications, but more as features. But that would be something interesting to discuss. Yeah.
Great. I'll follow up with just an email to see if that goes anywhere.
Cool. Thanks.
Yep.
Do we have any more questions for Corey?